Hello and welcome to Science News. My name's John Spertus and I'm here with my good friend John Beltrame down in Adelaide, Australia. And we're very excited to share with the internet and the world and all those interested some of the collaborations that we are doing with the Australians. John, would you like to introduce yourself?
It's good evening from here and good morning there.
Yes, as John mentioned, my name's John Beltrame. I'm the Professor of Medicine at Adelaide University and been interested now for a number of years in outcomes research, particularly fostered by yourself, John, as you know. You've been an inspiration to get outcomes research up and moving here within Australia.
Well, it's very exciting. I've known John now for almost a decade as we've been working and collaborating on different projects, and he's been very interested in trying to learn from some of our experiments in understanding the processes of care, understanding patient outcomes, and most importantly, understanding how we could do better in the future to improve the care and outcomes for our patients. And he's come to the U.S. on a number of occasions, to the QCOR conference regularly and to the scientific sessions. And now they're having their own conferences. Well, they've always had conferences, but they're continuing to have conferences in Australia. And this year he could not come to QCOR because they're having their conferences in Adelaide. And so the idea, really John's brainchild, was to try and bring the conferences together by having a shared symposium. And do you want to tell us a little bit about the symposium?
Well, that's exactly right, John. I was hoping I could have my cake and eat it too, because I've been coming to QCOR now for the past 5 years. It's a meeting I enjoy coming to every year. Unfortunately, in Australia, we don't have anything along the same lines, and it's the premier meeting for sort of outcomes research. What we have in Australia here that I'll be attending in a day's time is the Heart Foundation meeting. So the Heart Foundation meeting is every couple of years, and it has basic science, clinical studies and epidemiology research. And so this was an opportunity to link the two meetings up because our meeting starts tomorrow morning, which will be Thursday morning here, going through to Saturday. And so there was only a very small time interval that we could find that was common between the two meetings. So it will be a breakfast meeting on Friday for us and a Thursday evening meeting for yourselves.
Yeah, the 13.5-hour time difference does make a little bit of a challenge for, I guess, 12.5 from the East Coast. So tell us a little bit about what you're going to be sharing with us tomorrow, that your burgeoning registries in Australia.
So what we've now had operating for just over 12 months, CODOSA, which stands for the Coronary Angiogram Database of South Australia. So this was based on the CAF-PCI registry, and we're using the same data form with a few additional fields and Australianised. And so that's given us a unique opportunity to be able to compare and contrast the characteristics of what we're doing down under here to what's happening in the States. Obviously, CAF-PCI has been running a lot longer. There's a lot more data there. But so this gives us a first chance to actually compare some of this data. But the session is based upon sort of the future of international outcome research collaboration. And so we're expanding, not only looking at the registry, which gives us an opportunity to compare data across both countries, but also comparing the differences in disparities that we see in the different countries. For the African American people in the States there, and Paul Chan is going to speak on that. And here in Australia, we have the Australian Aboriginal people. That is a clear disparity that we'll be sharing with you on.
You know, I think that there's several things that really excite me about this. First, developing outcomes research and your own registries, there have been some very nice publications in Circulation, Cardiovascular Quality and Outcomes looking at disparities in the Aboriginal population. But as far as I can tell, they've often been administrative level databases. They haven't had the clinical detail that I think your registry is going to provide, which I think will be very insightful to understand. First, are there clinical reasons to justify some of the differences in care? Second, are these really just differences in treatment strategies, or are there really disparities, meaning that there are worse outcomes? And by looking at the outcomes, we'll be able to understand, is this a problem that needs a fix or not? And what I really like about the way you've designed the registry is that it is very synergistic with the NCVR registry that we're collecting in our country. And there are lots of differences in the way people treat coronary disease, and yet there's a culture about what's the right way. And in the United States, for example, we so predominantly use drug-eluting stents that there's very little variability, and so it's hard for us to appreciate the real-world outcomes of drug-eluting stent use, because essentially everyone gets them. Over 80% of patients get them in our country, and those who don't are very, very different than those who do. However, in Australia, there may not be, and we'll find out tomorrow, quite a predominant use of that particular stent technology. And those differences across the countries, there's likely to be many more similar patients in our country treated with drug-eluting stents that in your country are treated with bare metal stents. And it will give us an opportunity to start to look at the differences in the way we manage patients, whether it's stents, whether it's the use of anticoagulants in the cath lab or radial or femoral approaches, and understanding their care, their in-hospital outcomes, and eventually their long-term outcomes, I think will be very informative for learning from each other what might be the best way, and start to introduce new ideas and new strategies across the countries to provide better care for all patients in both countries.
Exactly. The opportunity to look at variability and understand the variability and then its impact on outcomes is the way we learn, and I guess is a fundamental principle in outcomes research, isn't it?
It sure is. It sure is. Well, I really want to thank you for taking the time. I guess it's evening, but you pulled away from your busy clinical load to share with us what's coming up tomorrow. We're very excited in the U.S. about it, and I think it will be a very exciting exchange. I'm looking forward to the data being presented, and I'm really looking forward to the discussions both in Australia and in the U.S. about how we look at the data and our different perspectives. And your leadership in organizing this and creating the satellite links is much appreciated by me and my colleagues here in the U.S., so thank you very much.
Okay, thank you.